My name is Mark Gonzalgo. I am Director of Robotic Surgery at Stanford Hospital. The Vinci Surgery, I believe, has several advantages compared to other treatments for prostate cancer. Most notably, less blood loss. There may be less pain requirement associated with the procedure, a faster recovery period, and shorter catheter time. When you're talking about surgical options for treatment of prostate cancer and comparing it to radiation therapy, one of the things that you have to keep in mind is that with surgery, it involves complete removal of the prostate gland. With that, you'll be able to have pathologic confirmation of the diagnosis of prostate cancer. And for many patients, I perform a lymph node dissection robotically, which can also provide additional staging information that can be used to guide further treatment options. When you compare robotic surgery to open surgery, some of the advantages may include less blood loss, shorter incisions, faster recovery, and less catheter time. So when you're considering treatment options for prostate cancer and when it's narrowed down to either surgery or radiation therapy, one of the advantages of surgery, particularly with the robotic approach, would be for a definitive diagnosis. That is, one is able to remove the prostate in its entirety and confirm the diagnosis that was initially made with the prostate biopsy. I think one of the other concerns for patients happens following treatment. That is, how do we monitor whether or not cancer has returned? With surgery, whether it's open or done with the Da Vinci system, the PSA level should technically drop to undetectable levels by the blood test. Whereas that's not always the case with radiation therapy. So you're able to follow patients, I believe, in a more definitive manner following surgery compared to radiation. Certainly both treatment options are viable depending on the patient type, but surgery, I believe, represents the gold standard for treatment of prostate cancer. So when you're comparing the different treatment options for prostate cancer, whether it's surgery or radiation, one of the things that should be considered, particularly with radiation treatment, is that the PSA level may not fall to undetectable levels. That is, a patient's PSA may fall to low levels, but it also may experience what is called a bounce effect, whereby the PSA level can then begin to rise and then fall back down even after treatment. I think the other thing to consider is that when someone is considering between a surgical approach or an approach with radiation, at least as first-line therapy, that it is much more difficult to perform surgery on the prostate following radiation treatment than it is to deliver radiation therapy, whether it's in an adjuvant or salvage setting following surgery. The technical term for performing a prostatectomy following radiation treatment is a salvage prostatectomy. Unfortunately, that procedure is associated with a higher complication rate compared to if the surgery was done as an initial treatment. So what I tell patients who are considering between a surgical approach or an approach with radiation for treatment of prostate cancer is how we're going to follow them once treatment has been completed. And for the most part, it is easier to follow patients following surgery because that PSA level really should drop to undetectable levels. So that if a PSA level were to come back following surgery, then we would consider whether or not we could proceed with radiation or other treatments at that time. For radiation, sometimes it's a little more difficult because that PSA level may not drop to undetectable levels. And so what can happen is the PSA can bounce upwards and bounce back downwards, and that certainly can be a cause for concern for patients because of the detectable levels of PSA which can occur following radiation treatment. With respect to patient recovery and outcomes with Da Vinci surgery compared to open surgery, we've certainly seen faster recovery in terms of getting back to daily activities or work. I think across all types of surgery, there's certainly less requirement for blood. Blood loss has been virtually minimal across the board with Da Vinci surgery. Finally, the incisions and benefit for patients with less pain or discomfort following surgery, I think, have all come with similar cancer controls. I think one of the things that we hear frequently from patients is the surprise. That is, how surprised they are with how small the incisions are, and also with the lack of really any significant pain or discomfort. And so as a surgeon, I think that is always a very satisfying feeling when I go to follow up on patients and see them walking around on the same day as their surgery in the hospital, and then getting that sort of feedback from them. I'm a Da Vinci surgeon because I believe that it offers an excellent option for patients who are seeking a minimally invasive treatment for prostate, bladder, or kidney cancer. I think the advantages of the three-dimensional vision, magnification, less blood loss, and better patient outcomes with respect to recovery have all influenced my decision to use a robotic approach for many of my cancer surgeries.